Hi everyone, I am Dr. Chanda Hingorani, a glaucoma specialist from Mumbai. This year, 12th October will be observed as the World Sight Day. It is an international day of awareness which is held every year on the second Thursday of October to focus attention on the global issue of preventable blindness and visual impairment. If we go through the statistics of blindness, they are quite frightening. WHO, that is World Health Organization, has estimated that there are about 285 million people globally who suffer from some form of visual impairment. Out of these, about 39 million people are totally blind and the remaining 246 million people suffer from low vision. If we look at India itself, we have about 19 million people who are suffering from total blindness. What is saddening to note is that many of the diseases which cause this blindness can either be treated or prevented if timely intervention is done. Hence, this World Sight Day, let us all pledge to achieve the goal of universal eye health. And the first step to achieving this goal is creating awareness about certain diseases that can cause blindness. These include cataract, glaucoma, refractive errors, and certain retinal pathologies like age-related macular degeneration and diabetic retinopathy. We all know that our body goes through a lot of changes as we age. It's the similar case with our eyes also. Knowing what to expect and when to seek medical or professional attention will help us to safeguard our vision in the long run. Hence, it is very important for all of us to know what are the warning signs of certain diseases that can cause blindness. Having said that, I would also like to emphasize that there are certain eye diseases that give no warning signs and symptoms. They develop painlessly and the patient may not notice any changes in his vision till the disease has reached a very advanced stage. One such eye disease is glaucoma. Glaucoma is also known as silent thief of sight because it can steal a person's vision without giving any warning signals. According to Glaucoma Society of India, there are already 12 million people in our country who are suffering from this disease. And this figure is expected to rise to 16 million by 2020. So what is glaucoma? It is a chronic eye disorder that affects the nerve at the back of our eye. This nerve connects our eyeball to the brain and is responsible for vision. In majority of the cases, glaucoma is caused by an increased pressure inside the eyeball. This pressure is known as intraocular pressure. Although any individual at any stage of life can develop glaucoma, there are certain persons who are at higher risk of developing these diseases. These include persons over 40 years of age, those who already have a family history of glaucoma, persons suffering from diabetes, and those who have high myopia or high hypermetropia. That is, if you are using high plus or minus numbered glasses. If you have any of these risk factors, I would recommend that you schedule an appointment with your ophthalmologist immediately and ask him to do specific test for glaucoma. Another frightening fact about glaucoma is that it cannot be cured because there is no way we can regenerate the nerve fibers of the eye. However, with early diagnosis and a proper treatment, we can ensure that the progression of the disease is halted and the vision is stabilized. Therefore, it is very important that you undergo regular eye exams to catch this disease at an early stage before it reaches the blindness stage. To conclude, certain wise lifestyle changes, a little awareness of certain diseases that can cause blindness, and annual eye exam is a low stress way to keep tab on your eye health and preserve your vision. This World Sight Day, I request all of you to schedule an appointment with your ophthalmologist. Stay informed and preserve your eyesight. Thanks.